Imagine you've been living with pelvic pain for years. You've tried medications, you've tried birth control. You've been told it's just bad periods. Finally, you sit across from your doctor and they say, you know what, let's just remove the uterus, that'll fix it once and for all. It sounds final, clean, like you'll walk out of the hospital and your pain will be gone forever. But here's the truth, and I really want you to hear this. Hysterectomy is not a cure for endometriosis. Hi, I'm Dr. Abhishek Mangeshikar, robotic surgeon and endometriosis specialist. In today's video, we're going to talk about one of the most common and harmful myths in gynecology, that hysterectomy cures endometriosis. I'll explain what a hysterectomy actually treats, why it often fails to solve endometriosis-related pain, when it might be appropriate, and the right way to approach surgery if you have this disease. By the end of this video, you'll know exactly what questions to ask your doctor before agreeing to such a major operation. Let's understand why this myth exists. The hysterectomy cures endo myth has been around for decades. It partly comes from older thinking in gynecology, when pelvic pain was assumed to come entirely from the uterus. Back then, if a patient had pain and heavy bleeding, the logical conclusion was remove the uterus, remove the problem. And in some conditions, that's true. But here's the catch. Endometriosis doesn't live inside the uterus. By definition, it's tissue similar to the uterus lining, but it grows outside the uterus, on the ovaries, bowel, bladder, peritoneum, pelvic nerves, even the diaphragm or lungs. So you can take out the uterus, but the disease outside is still there, still inflamed, and still capable of causing severe pain and organ damage. To make matters worse, many international society guidelines still describe hysterectomy with ovary removal as the definitive treatment for endometriosis. These guidelines urgently need to be re-examined and rewritten because this messaging continues to mislead doctors and harm patients worldwide. Let's understand what a hysterectomy actually treats. A hysterectomy can be a highly effective treatment, just not for endometriosis itself. It works best when the disease is actually inside the uterus. For example, adenomyosis, where endometriosis-like tissue grows deep into the muscular wall of the uterus, making it bulky, tender, and causing heavy, painful periods. Fibroids, which are benign tumors of the uterine muscle that can cause heavy bleeding, pelvic pressure, and pain. Or severe uncontrollable uterine bleeding or abnormal uterine bleeding not responding to medical therapy. Certain cancers, such as uterine or cervical cancer, where hysterectomy is often a life-saving operation. In these cases, removing the uterus addresses the exact organ causing the problem. That's why it's a definitive cure for adenomyosis, fibroids, and uterine cancers, but not for endometriosis growing elsewhere. Let's understand where a hysterectomy falls short for endometriosis. Endometriosis is a disease that often spreads beyond the uterus early on. If you remove the uterus but don't remove those lesions, you've left the main problem behind. What happens in practice? A hysterectomy is done for endometriosis without mapping the disease first. No thorough inspection of the bowel, bladder, or deeper pelvic spaces is performed. Lesions on the rectum, ureters, or pelvic nerves are left untouched. The patient recovers from a major surgery only to find their pain is still there or returns within months. I've had patients come to me after hysterectomy saying, I thought this was supposed to cure me, why am I still in pain? And the answer is always, because the endometriosis outside the uterus was never addressed. When I review surgical videos for endometriosis and I've had a conversation with the doctors who have performed the hysterectomy, they say it's too difficult for them to perform the endometriosis excision, so they do the rest of the surgery, which is removing the uterus, and say, oh, if we've left anything behind, you'll take care of it later. That's a really big problem and is going to compound the surgery difficulty when we actually go in the second time. When hysterectomy is presented as a cure for endometriosis without excision, it can lead to false reassurance. Patients think the problem is gone when it isn't. Missed disease, especially in hard-to-reach places like the diaphragm or the deep parametrium. Unnecessary removal of healthy ovaries, which may trigger surgical menopause and long-term risks like bone loss and cardiovascular disease. More complex revision surgeries later. Once scar tissue forms and when the uterus is not in place, which acts as a marker for different compartments of the pelvis, removing remaining disease becomes harder and riskier. I've had the privilege and the circumstance of operating on one of the largest series in the world of patients with severe symptomatic endometriosis after hysterectomy. These are among the most challenging surgeries that we do. And why? Because the uterus and sometimes the ovaries are already gone. but the disease was left behind. By that time, patients have usually undergone multiple operations and the pelvis is filled with scar tissue and adhesions. In one such case, a patient developed severe kidney damage years after her hysterectomy because the nodules around the ureters had never been removed. By the time she reached me, she was just days away from losing kidney function. We had to spend hours meticulously separating organs, scar tissue, and disease to save her kidneys and restore her health. This is exactly why hysterectomy without excision of endometriosis is not only ineffective, but often harmful. It creates a false sense of security while the disease silently progresses. Let's see when hysterectomy might have a role in endometriosis. I'm not saying hysterectomy is never part of the treatment plan. It can be considered if you have both endometriosis and confirmed adenomyosis or fibroids causing symptoms. You've completed your family or don't wish to preserve fertility. You understand that hysterectomy must be combined with complete excision of all visible endometriosis at the same time. The key word here is combined. Doing a hysterectomy alone for endometriosis is like changing the roof of a house while the termites are still eating through the walls. If surgery is needed for endometriosis, here's what it should involve, whether or not hysterectomy is a part of it. Detailed preoperative mapping using expert MRI or transvaginal ultrasound with an endometriosis protocol. Inspection of the entire pelvis and abdomen during surgery, including the bowel, bladder, ureters, diaphragm, and pelvic sidewall. If there are accidental diagnoses, they should be documented rather than left alone and ignored. Excision of all visible lesions, not just burning them on the surface, but removing them completely. Organ-sparing techniques where possible, especially for fertility preservation. Multidisciplinary collaboration involving colorectal, urological, thoracic, if the disease involves bowel, urinary tract, or diaphragm. Tailored decisions about uterus and ovary removal based on the disease, symptoms, and future plans. Hysterectomy is not and never has been a cure for endometriosis. It can be the right solution for adenomyosis, fibroids, and uterine cancers, but for endometriosis, the only surgical approach proven to reduce pain and improve quality of life is complete excision of the disease, regardless of whether you keep your uterus or not. If your doctor suggests hysterectomy for endometriosis, your first question should be, will you also be excising all visible endometriosis during the same surgery? If the answer is vague or they say it's not necessary, get a second opinion. Too many people have had their uterus removed under the promise of a cure only to discover the pain was never coming from the uterus alone. If you know someone facing this decision, please share this video. You might save them from unnecessary surgery or from years of continued suffering. For more evidence-based, patient-first information about endometriosis like this video, subscribe to the channel and share it. Your support helps others find the truth they deserve.